Hey everyone, don't mind the seagulls and birds in the background. I'm just out by the water. So for 3 months, a lot has changed between 2 and 3 months. One of the very major things I'll get to, but some of the little things, I had a lot more range of motion. I could run, I could move around. That dangling feeling I mentioned before, it disappeared. I started to feel more comfortable. I started to wear more loose underwear, which was fine. I did notice, however, when I wore tighter underwear, like boxer briefs with a pouch, it would push it up a bit, and then it would curve, and the curving would make the scar kind of tighten. And because of that, it would kind of look like this, instead of like just hanging down. And that bothered me a little bit just because it shortened the length a little bit and I just didn't like the appearance of it. But I realized if I just let it hang, which I was able to do with the weight now not being a big bother, it would lengthen it. And I actually went from, after surgery, I went from 5 inches down to 4. So now I'm about almost 5 again, like 4.7. I also started wearing silicone strips on the scar to kind of loosen it up a bit, so it's not as tight. And I scar kind of weirdly, like it's really raised and spread, and like hypertrophic scarring and keloid scarring. I'll show you what I mean when I get to my arm, but so that caused, so it grew, that was better. As I started to wear boxers, which I actually never wore before surgery, so it's kind of interesting how your underwear changes. I stopped taking my nerve pain medication. I don't really need it anymore. I don't have nerve pains, although I did have some weird cooling sensations, but those are apparently signs that the nerves are growing back, so that's good. And so no pain really besides that, but the major thing that's happened is, I know in my last video I mentioned that the exit at the end of my urethra was kind of narrowing. Well, it narrowed even more, and I went to another doctor and they said I should dilate it. So I should stick, like, I have like catheter tubing, and I would just use that and kind of push into it. So that would keep it open, and I started by doing that just once a day, but then I'd notice when I push, like, I'd put it in and I would leave it for 5 minutes and take it out, it would be difficult to put it in again. So I started doing it 3 times a day, and then I ended up actually one day not being able to get it in. So I went to the doctors and they sent me to the hospital, and good thing they had, because when I got to the hospital, the urologist on call tried to dilate me, and that means like sticking catheter tubing all the way up my urethra towards my bladder. No, I don't have any sensation, so I didn't feel uncomfortable or anything. No pain. But it worked the first time. I was able to go normally, but then after that, it, like an hour later, nothing. I had to go, nothing was coming out. It was not good. So they tried to put a catheter up my urethra so that way I could go, but it wasn't working. So they had to put in a suprapubic catheter right back straight into my bladder. So it was such an emergency because I had to go so bad, and the pain was building up, and the pressure, it's like the worst feeling. You have to go so bad. So they ended up, it was a really crappy doctor, like bad experience. But what had happened is they didn't even give me pain medication, nothing like that. And they did the incision, and they basically shoved like a tubing right through my bladder. And that's the most pain I've been through in my entire life. Like, more pain than the surgery was itself. So by the end of that, I was just so done. I didn't want to have the catheter back in because bladder spasms would come back. I wouldn't be able to have my same activity level. It would interfere with work. But I had to have it. So I had it for about a week, and then during that week, I noticed that I was actually peeing fine again, through my urethra, fine. At this point, now I was dilating by sticking the catheter tubing up it all day long, and I just leave it in. So I could pee through that tubing still, even though it was just kind of hanging out the last inch. And I talked to my urologist, and he said, it sounds like you have a stricture at the tip, which is very common apparently, and it's probably only like about half an inch to an inch. So he said that I just have to dilate that, and that they could fix it in my second stage of surgery. So in short, I got the catheter out. The doctor that put it in took it out, and he was just awful. He didn't really care. He just kind of left me in like a pile of my urine. It just wasn't good. But then 2 days after he took it out, same problem. Couldn't go. Had to go back to the emergency. This time, they tried to put it more through my urethra a couple times. They really tried to push it, and it wasn't working. So the doctor tried to put it in with, this time I was on like morphine, and he kind of got it in, but it kind of just like leaked on my insides, and that burned. So anyways, they admitted me because it relieved some of the pressure from the urine. They admitted me, and then I ended up getting sedated the next day, just conscious sedation, and they put in a new suprapubic, and I've had it ever since then. So I've probably had a total of 3 weeks now. And I talked to my surgeon, and he said that I should keep it in now until I get a stricture repair. And they had noticed that the stricture, because they did a scope, is not just at the tip, there was one at the base. So while I was dilating the tip one, I wasn't dilating the base. So that means that I'm going to have to have a surgical repair. So in that repair, they're going to make a new skin graft out of my abdomen. They're going to take that, and they're going to replace the bad parts of my urethra with that new made one. And it's supposed to be a 2-stage procedure. So they're going to do the first stage hopefully in September, so about 4 months post-op. And they're going to do the second stage at the same time as my stage 2, which has to be 6 months after the repair. The repair has about an 80% success rate. He said he feels pretty confident about it, and that strictures are pretty common because there's not as much blood flow to the tip in the end, so that's usually where you get them. So, yeah, I mean, I'm just hoping every day, waiting to hear about the surgery date, because honestly, having a catheter has caused so many problems. I'm in pain a lot of the time, even though I'm on bladder spasm medication and painkillers, still in pain. I can't run, I can't do much physical activity. I kind of have to rest like all day long, so that's a huge pain. I'm not used to this kind of thing, and I was feeling like everything was going right. I was done with the recovery, and this happened. So it kind of set me back a little bit, and it's been hard emotionally on me too, and mentally, because people still have to help take care of me. My girlfriend's been amazing. She had to help shower me for a while, and I need help changing the bags sometimes. It interfered with work too. I can't work long days, I get too tired. So I'm not really working. So I'm just kind of laying here waiting for my surgical date. And so it's been a little bit of a bummer month so far, but I'm hoping it'll get better, and I'm looking up. My arm's fully healed, and it actually healed like right after I made that last video. As you can see, it's kind of lightened up a bit. The spot was on the underside, you can't even see it. I've been using a silicone sleeve on it. It's lightened it up, and it's made it a lot softer too, so that seems to be working. That's pretty much, oh, and I started wearing it up, the penis up in my underwear to kind of stretch out the scarring, and that works really well. So it's really not painful at all, but there has been some buildup of reddish, brownish, foul smelling stuff, and apparently that's normal if you're not dilating, and I stopped dilating for a while, so that can build up in there because you're not flushing anything out. So I had to dilate again, and now I'm starting to do it like a couple times a day, leave it in a bit, but it's I think it could be an infection, and I'm started on antibiotics because it hasn't stopped leaking, and it's been like 3 days now. But yeah, that's about it for my update, and hopefully the month gets a bit better, and I'll let you know what's happening next month. Thanks.